In my own experience, telehealth visits have been a great way to safely connect with my patients during the pandemic. More broadly, this has been an extraordinary time for telehealth. We've seen increases in the number of healthcare providers offering telehealth visits, older patients' comfort with video technologies, and the number of older patients who've actually now had a telehealth visit.
In the 2019 survey that we conducted, only 4% of older adults aged 50 to 80 had a telehealth visit. And in 2020, in June, when we conducted the next survey, 26% of those people reported their telehealth visit from March 2020 to June.
Yet, we still have a lot of work to do to ease older patients' concerns about telehealth and to match patients' preferences and needs with when and where a telehealth visit can truly substitute for an in-person visit.
Our data from the June 2020 survey showed that 17% of older adults still hadn't used any video conferencing technologies to date. So finding ways to improve access and accessibility to telehealth is really important right now, as that may help us protect the people who are most vulnerable to the negative effects of COVID-19, which unfortunately disproportionately affects older adults. Getting this data out right now is super important because many of the policies that paved the way for the rapid expansion of telehealth that we've seen in the last few months, they're temporary, and we haven't made these changes permanent yet. So our policymakers right now are hard at work, working to ensure that these changes persist. As we move into fall and the threat of increased numbers of infections rise, we need to be prepared to keep our population safe, and telehealth is an important part of that equation.